In this study that was presented by Uma Barade, we analyzed our Beat AML data set for patients with NPM1 and KMT2A rearrangements, both who respond well to menin inhibitors. Both of these mutations occur more frequently in younger AML patients, and so the study was done to be able to characterize the survival and outcomes of these patients in the older population of newly diagnosed AML patients 60 years and older. The primary endpoint of this retrospective analysis was to determine the prevalence and outcomes of these mutations in newly diagnosed AML patients 60 years and older, with the therapies that were available during this data set collection, which was from November 2016 to June 2024. The results of this analysis showed that 18.9% of the patients enrolled into the Beat AML master trial had an NPM1 mutation, and that we had 3.6% of the patients had a KMT2A rearrangement. We saw that the NPM1 mutated patients had a median overall survival of 18.4 months, which included all therapies. However, when we separated out the therapies that the patients received, we saw that the median overall survival was 21 months for patients who received treatment on a Beat AML master study, which was 35% of the patients in this analysis. And we saw that 19% of the patients in this analysis that received venetoclax and azacitidine or hypermethylating agent off treatment had a median overall survival of 22 months, which is comparable. We also saw that 28% of the patients in this cohort received intensive chemotherapy with a median overall survival of 41.6 months, and that 8% of the patients received non-intensive treatment with a median overall survival of 6.3 months. For the KMT2A patients, we saw that 23 of these patients had treatment-related AML, and that 31% of these patients had complex karyotype. And the median overall survival of these patients, regardless of treatment, was 6.5 months. When we broke this down by the treatments that they received, we saw that 38% of the patients received a treatment on a Beat AML study with a median overall survival of 31.6 months. We saw 15% of the patients received venetoclax and a hypermethylating agent with a median overall survival of 5 months. With the 15% of patients that received intensive chemotherapy, they had a median overall survival of 12.7 months. And then there was 15% of the patients that received non-intensive, and they had a median overall survival of 2.9 months. So the clinical significance of these results come from this study is that this is one of the largest cohorts of KMT2A rearranged older patients that has been analyzed to date. And we see that the targeted approach for KMT2A patients had a great increase on the median overall survival of 31.6 months when compared to intensive chemotherapy of 12.6 months. And if these patients aren't candidates for intensive chemotherapy, that drops to 5 months with venetoclax and hypermethylating agents. So therefore, it is really important for patients to get these targeted treatments, and we're really looking forward for FDA approval of inhibitors for KMT2A in the newly diagnosed setting, as they've recently been approved for relapse refractory patients. For the future of this, we will do another data refresh. We do have a partnership with Syndax Pharmaceuticals, where KMT2A and NPM1 patients are being treated in the newly diagnosed setting. So we should be able to have this data upfront with Rev Ven Aza to see how that also increases median overall survival for these KMT2A, and we'll be looking forward to that in the future.